This presentation will be dealing with the mental disorder schizophrenia. Schizophrenia is typically defined as a dangerous mental disorder that alters how a person functions, meaning the way they behave, think, and feel, by causing them to lose touch with reality or interpret it abnormally. A defining characteristic of schizophrenia is a division between mental functions and reality. It is this disparity that causes those affected to lose contact with the real world. The understanding of schizophrenia has evolved greatly over the past few centuries. In the late 19th century, Emil Kraepelin, a German psychiatrist, first labeled the symptoms of schizophrenia as dementia praecox, a premature dementia. He emphasized differentiating this from other disorders and illnesses such as the insanity resulting from syphilis or the symptoms resulting from manic depression. He was one of the pioneers for understanding the disorder as a biological disorder rather than the result of environmental influences. In contrast, Eugene Buehler believed it to be a fundamental disorder of thought and feeling. He was first to coin the term schizophrenia, meaning split mind, because those with the disorder have thoughts that are disconnected from reality. Modern research views schizophrenia as a dopamine disorder that can be treated with drug therapy. The causes of schizophrenia are relatively unknown to scientists as of now. However, there are multiple indications that can appropriately diagnose it as a brain disease. Some factors that work together to cause schizophrenia include genetics, brain chemistry, and the environment. In terms of brain chemistry, there is evidence that schizophrenia may originate from issues with neurotransmitters, specifically dopamine and glutamate. There have also been connections made to various differences in brain structure and the central nervous system in schizophrenic patients. In order to determine the causes of schizophrenia, it is important to look at risk factors as well. Various risk factors include a genetic connection in which a previous family member has had the disease or a hyperactive immune system that begins to attack one's own body. Pregnancy and birth issues are also a major risk factor. Problems in infant brain development, malnutrition of the mother and baby, toxic exposure, and viral infections are all linked to the onset of schizophrenia. An additional risk factor that was linked to significant psychotropic drug usage at a young age, which can harm the brain prematurely. The symptoms of schizophrenia can be categorized into positive, negative, and cognitive. Positive symptoms are abnormalities present in the patient such as delusions, auditory hallucinations, and disorganized thinking, speech, and motor behavior. Negative symptoms describe traits that are often associated with major depressive disorder, such as reduced expression, loss of interest, and general withdrawal. Cognitive symptoms encompass a patient's difficulty in focusing, memory, and processing information. Not every patient with schizophrenia expresses all these types of symptoms. Treatment for schizophrenia is not a clear path. It is typically a combination of pharmacological and non-pharmacological approaches. The pharmacological approaches include either pills or injections of antipsychotics. The first antipsychotics used to treat the disease were dopamine antagonists, because it was believed schizophrenia was caused by excess dopamine in the brain. It is now believed schizophrenia is caused by an excess amount of dopamine in the mesolimbic system and too little dopamine in the mesocortical system. The current accepted antipsychotic is Abilify, which is a third-generation antipsychotic and is a partial dopamine antagonist, affecting the pathways differently. However, it only addresses positive and negative symptoms and is not an effective treatment for cognitive symptoms. Another problem is that it is often difficult for a patient to follow the treatment plan due to the delusional paranoia. It is not uncommon for a patient to believe the pills are a form of conspiracy against them, and injections are a frequent alternative in that case. In some cases, hospitalization is required for treatment for the patient to receive proper nutrition, hygiene, and sleep. The non-pharmacological approaches mostly consist of therapy, both individual, group, and cognitive behavioral. There is some discrepancy on the prevalence of schizophrenia. However, according to the WHO, schizophrenia has a point prevalence of about 4.6 per 1,000 people, a period prevalence of 3.3 per 1,000 people, and 4 per 1,000 people for lifetime prevalence. Incidence is about 0.2 cases per 1,000 people per year. Typical onset age for both men and women is between 15 and 24. However, males have a higher lifetime risk for the disease, and the WHO has recorded 12 million cases among males versus 9 million cases among females. There's also variation in prevalence across countries, with developing countries showing lower prevalence than industrialized countries. Prognosis for schizophrenia depends on various factors. However, overall, about a third of patients see lasting improvement over their lifetimes. 1/3 see some improvement, however, experience relapses, and 1/3 experience permanent disability. Some factors that influence whether the prognosis is good are a high level of functioning, for example, getting good grades or a good job, before onset of the disease, late onset, few negative symptoms, high levels of family support, and shorter duration of untreated psychosis. Factors that tend to lead to a worse prognosis are early onset of the disease, poor functioning before onset, family history of schizophrenia, many negative symptoms, and a longer duration of untreated psychosis. Substance abuse often makes the prognosis worse, as it can lead to drug non-adherence, relapses, hospitalization, and loss of social support. Women have a tendency to have a better prognosis than men because they tend to respond better to treatments and have a later onset. Prognosis also varies across countries, with developing countries showing a better prognosis than developed ones. In a study by the WHO, for example, the percentage of cases that received full remission ranged from 3% in the US to 54% in India. A great stigma exists around schizophrenia. People that suffer from the disorder are referred to as insane or crazy, and have historically been locked away in institutions to segregate them from the rest of society. However, the disorder is not nearly as rare as people think, and affects about 29 million people worldwide. The prejudice toward those diagnosed has created barriers to housing, employment, and many social opportunities. The negative connotation surrounding the disorder also prevents many from seeking out help and treatment, only perpetuating the issue.